The European Institute for Biomedical Imaging Research, EIBIR, is at the forefront of coordinating projects to support the development of biomedical imaging technologies and the dissemination of knowledge. With EU-funded projects that EIBIR leads and supports, the Institute is working towards the goal of building stronger, more resilient health systems. In this interview, EIBIR's Scientific Director, Professor Regina Biedstan, will discuss European funding opportunities, highlight EIBIR's achievement in securing funding for biomedical research, and outline the Institute's strategic priorities for the coming years. Professor Biedstan, hello and welcome.
Thank you. Welcome. And thank you very much for inviting me.
You're used to moderating connection.
Yes, I was so
welcome
used.
to everyone.
Yes.
I know. I get that. Can you please explain us the primary role and mission of EIBIR in the field of biomedical imaging research?
Yes. A very good question, thank you. So EIBIR's mission is really to support the development of biomed technology research. And we bring researchers together to collaborate, and we help them navigate through the very complicated regulations of EU-funded projects, so they can have greater chances for success, to deliver their project, to obtain funding, etc.
And then you mentioned funding. Funding is tricky, you have to do it a certain way. What challenges do researchers face in funding applications, and how does EIBIR help them to overcome these obstacles?
Yeah, also a very good question, because indeed with all the cuts in budgets on science across Europe, also in the Netherlands where I'm from, there's a cut in the budget for the universities, and that's very sad. Meaning that if researchers would go and seek funding for a beautiful project, they face a lot of competition. And so their research project should be of very high quality, and usually that is with very short-term impact on society or on a patient, and also with a multidisciplinary approach, so showing that they plan a collaborative project. So all these requirements make it a little bit more difficult for researchers to obtain funding. And EIBIR can help them because, well, first of all, our track record speaks for itself. When a project is supported by EIBIR, the success rate or the chance for success is 36%, which is more than double the 16% of the EU average. So that's very good, right? And since we started with our institute, we have already helped researchers secured in total for 39 projects over 193 million euros. So this is really good. But that is because we do have a certain system in place. When a researcher is interested to seek support from EIBIR, their proposal will undergo an internal review by the Scientific Advisory Board of EIBIR. So we have experts from different disciplines. They evaluate the study design, but they also look at whether the project is aligned with the call or aligned with the EU research strategy. And if they think this is a very good one, then they also advise the PIs how to improve the study design or their proposal. So, you know, we help them already, in fact, already from the start when they seek our help. So EIBIR literally can help you researchers to from in all stages of the process. So from the pre-submission stage with the proposal writing, and once your project is funded, with the project coordination and management and dissemination of the results, so that you can really focus only on the science. And yeah, and I think that's one of the reasons why EIBIR's supported projects are really successful.
It's a very, very comprehensive offer. And you have a pool of specialists in
Yes.
grants and how to obtain funding,
Yes.
new funding. I really imagine it's a complicated labyrinth, a maze to navigate, right?
Very complicated, and especially very daunting for researchers who would like to do so but doesn't know the regulations and how to submit, and so it's very complicated. So that is where EIBIR is so happy to help these researchers. Really a very nice endeavor for us. Yeah.
You must receive a lot of subject proposals, people who want to have their projects funded, no?
Yes, yes.
Can you
a lot.
accept them all?
We try to support as many as possible, but again, the internal review by the scientific advisory board is essential, because if they really give a negative advice, do not submit it now, because maybe you could still work a little bit on the pilot data to improve your project, or it's not matching with the call. Then if the scientific advisory board give that advice, then we should take it seriously, because most often they are right. So that is the selection process that we have to go through first.
I understand. It's a very honest and transparent.
Yes, very
Yes.
transparent. Yes.
Wonderful. How does EIBIR foster multidisciplinary collaboration among different fields of expertise in biomedical imaging? You're the expert here, really.
Yeah,
to
yeah.
ask.
Multidisciplinarity. Yes, multidisciplinarity is really at the core of EIBIR and everything we do. First of all, if you want to understand the true value of imaging on patient outcome, you need to do multidisciplinary research, meaning that you need to prove that there is a benefit of using that imaging in the diagnostic treatment pathway of the patients. So that is multidisciplinary. We cannot do it by ourselves. And therefore, EIBIR has always been, from the beginning, a multidisciplinary organization. First of all, we bring the researchers from all different disciplines, so everyone can become a member of EIBIR, all disciplines, not only imagers. Then second, this scientific advisory board, a panel of experts from all different disciplines, because they have to evaluate the project and they are the experts. Then we have also looked into the strategic priorities for the coming years for EIBIR, and especially the research priorities. And the Scientific Advisory Board has identified 6 areas of research priorities, of which the most important is multidisciplinary research and collaboration, but among the 6 also artificial intelligence, emerging technologies, hybrid imaging, integrated diagnostics. You need collaboration for that, and quality and safety. So we are completely, multidisciplinary from all different angles.
Okay. Can you name some of EIBIR's key projects and initiatives?
Yes, definitely. There are so many, but I would like to, maybe first take a step back and explain a little bit why I mentioned these in 2 key projects, and it's about AI and cancer screening. You know that this society at the moment, we have an improved healthcare cost. So that's quite a challenge for our society in Europe. And that's not only in Europe, global also, because of the aging population, the unhealthy lifestyle, emerging technologies, advancement in technologies that are being implemented but not scaled back because we do not have the evidence whether they are really beneficial, but also we don't have the methods to select those patients who really benefit from using this technology. So all these add up in cost, and add to that also the administrative burden for hospital care providers and the persistent workforce shortages. What a challenge in healthcare. So if we want to tackle these challenges, we need to look at where are the biggest gains. And there are two areas that at EU level the discussion is taking place where we think that that could be the biggest gain. One is in screening, because screening can save patient lives. And second is in digital transformation, because digital transformation can improve the access to high quality care also in areas where there is less resources, underserved care areas. It can improve the workflow efficiency, so tackling the workforce shortages. It can boost precision medicine. And especially with aging population, not all elderly needs to be taken care of in hospital, because that's expensive and they have to stay long. So we need to shift it from the hospital-based to community-based care. So having the families supporting these elderly family members. And with that is the digital transformation that is promising to help us in transforming this care. And now going back to this screening and digital transformation, there are two projects that EIBIR is coordinated, and we are very proud we can coordinate that. The one is on digital infrastructure. It's called the European Cancer Imaging Initiative, which aims to build a federated infrastructure of millions of cancer images to develop and validate and benchmark trustworthy AI tools. And this infrastructure with data, the data bank, will be accessible to all stakeholders. Now, why do I mention this? Because this is a flagship initiative of the Europe Beating Cancer Plan. And the Europe Beating Cancer Plan is an investment program of the European Commission. So meaning that this is a high-profiling project where radiology is in the lead. And me as EIBIR, with my EIBIR hat, I'm very proud that we can lead, coordinate that project. And the other one, which is now running, is one on lung cancer screening. It's on the improving the access to screening of the high-risk population for lung cancer. And what we aim to do with that project, which is called the SOLAS, we aim to provide a toolkit, a toolbox or a guidance of how to implement individualized screening in your region or nation. So those are two projects in the screening and in the digital that are very important at this moment.
Referring to EU CAIM and Solace projects.
EU CAIM and Solace. Yeah.
There were very exciting news coming from EU CAIM. A delegation visited Brussels. The European Commission what was it, a few weeks ago, I
Yes,
think.
on February 6th,
How
we had
successful was this?
that was extremely successful. We had, well, all credits, of course, to the scientific lead of the UCAM, Professor Louis Marty-Bonmarty. But he presented the progress of the UCAM, and we are at the middle of that. And it was you've really felt that the European Commission take this project very seriously and want to make it happen. And now the next step is to make it sustainable, the infrastructure. And so we are now establishing an European Digital Infrastructure Consortium, meaning that this UCAM will be in the nations a legal entity. So yes, so this is a very high profiling and important project. The start of truly bringing AI in clinics.
Exactly.
Yeah.
Such important project here.
Yeah.
Brilliant. Thank you for that. Building on the success of EIBIR projects and initiatives like the EU Health Policy Thematic Network on advancing precision medicine for cancer patients, what are the strategic priorities for EIBIR in the coming years?
Oh, yes, that's a very, very good question and very important, of course. Yes, so we have been working on the revisiting and redefining the strategic priorities. And it was very clear for the EIBIR community that we should focus on advocacy and on multidisciplinarity and collaboration. What does that mean? We would like EIBIR as an instrument to have a stronger voice in shaping the EU research strategy. So meaning that we would like to advocate for a greater inclusion of biomedical imaging research in the EU funding programs. So that would be really ultimately our goal. Then the multidisciplinarity and collaboration, that is obviously we cannot do research by ourselves because we are diagnosticians. We need to collaborate to see whether this technology will truly benefit the patient. And therefore we focus on the multidisciplinary projects on collaboration with organizations and industry partners, with patient organizations. We focus on that kind of strategic alliances, which I think is very important to move the field forward. So that's very our focus. And the other focus is also to increase the visibility of EIBIR for the general public. The general public meaning maybe the radiologists or the scientists who have never heard of EIBIR, that they could also take the opportunity to make use of the support of EIBIR. So what we did is we organized webinars where that was open for the general audience, radiologists mostly, to share what EIBIR could do for them, and also to share the EIBIR projects, the strategies, and all kind of discussions on the themes of the projects that we are supporting. So these were very successful, and we will have 2 more this year, and one, in fact, in spring will be on how EIBIR literally help you and guide you when you want to go from project design towards project submission and running the project. We will dedicate a whole webinar to that aspect of concrete, guidance.
When will this be held?
We aim to organize that in April or May. So look out for that. Yes.
Okay, coming very soon.
Yes, coming very soon. And then the last is we are very active on social media.
I know.
You know that,
see
right?
you.
Yes, yes. So we are very active because we also think that every project that we are supporting, we has the right to give real-time updates to the public on nice new achievements and important milestones. So we are very active on social media with real-time information.
I think it is very important for you to communicate what you do and what the projects, research projects do. Often the lay population, as myself, we do not realize how important research is. And sometimes we think it may be too complicated to understand. The fact that you're publishing on social media in a language that can be understood by all shows that this is possible.
And that is indeed what you're saying is so true, because we've seen that research is a little bit less scary in that way. They can see that research is not always hard work and tough. You can also have successes. And by the way, research is the bottom of everything what we do, because without research, we would not even have congresses. We would not even have a specialty or a discipline that is continuously evolving. So yes, I'm so pleased that there are so many ambitious researchers out there to work for imaging.
Without research, we would not be here. I can definitely agree on that.
Yeah.
Thank you so much, Regina, Professor Bitzstein, for your time. That was very instructive. Thank you, everyone, for watching. We will now take a short break, and we will be back very shortly. Thank you.